Hello, Andrew Colsky here with StopMyOCD.com. Today we're going to talk about Tourette syndrome, what it is and how to treat it. So when we talk about Tourette syndrome, it's important to start and talk about tics. Tics are sudden, rapid, recurrent, involuntary movements or sounds. When we talk about those, let's talk about specifically the fact that Tourette syndrome is found 4 times more in boys than in girls. It usually appears around 4 to 7 years old. It must appear before the age of 18 in order to fit the diagnostic criteria. And it's caused by genetics and neurobiological factors. The common comorbidities with tics are ADHD or OCD. There's a strong genetic relationship there. Anxiety disorders are also common with tic disorder. Now, you hear me talking about tic disorder at the same time I'm talking about Tourette syndrome, and that's because tics are really the basis of Tourette syndrome, and in a little bit I'll explain where the difference in the name comes in. But in general, when we talk about tics, there are 2 types of tics. The first type is a motor tic. Those can be simple or complex. The second type of tic is a vocal tic. And again, those can be either simple or complex. So let's talk about motor tics, and let's talk about simple tics. So simple motor tics are brief, forceful movements of one muscle group. It can be a grimace, an eye roll, an eye blink, a face scrunch, limb jerk, something like that. So, for example, let's give you some physical examples of these tics. So a grimace could be like this. A person grimaces and they're not really thinking about it. Another thing could be an eye roll. So that would look like this. We've all seen eye rolls before. Then there's an eye blink. Maybe you've seen somebody doing just blinks, and it seems different than just a regular blinking their eye to wet their eye. The next one would be a face scrunch, so that might look like this. So they're scrunching all the muscles in their face. Or there could be a limb jerk. So that could be maybe something like this. So these are all simple, basic motor tics. So let's talk about vocal tics. Well, simple vocal tics could be things like brief, meaningless sounds. And those are anything from sniffing, throat clearing, things like that. So you might notice someone going or they have those would be sniffing and throat clearing. Those are simple vocal tics. So let's talk about motor tics now from the complex side. So you've got the complex, which typically has multiple simple tics together, and they may even have coordinated movements. So one example of that could be tapping objects, maybe up here, or tapping something. Or it could be parroting another's movements. So they see somebody doing something and then they parrot it and do the same type of thing. Maybe we've got something like when we talked about a simple, muscle movement, maybe we've got like a muscle movement along with a face scrunch and maybe even a sniff. So that becomes more complex. Same thing when we talk about vocal tics, and we look at the complex type of vocal tic. We have someone who might mimic purposeful speech. Maybe it's whole words. So again, someone else is saying something and they're mimicking it using whole words. Sometimes it can be obscene words. And oftentimes, because of the media, when we hear about Tourette syndrome, we think of people using profane language and screaming out words. And that does happen, but it's not the most common thing. It's actually uncommon, but it can happen. And then there's parroting another's words, which we call echolalia. So somebody says something and then the person with tic disorder would parrot it back, saying the same thing that that person has said. So a little bit more about tics themselves. The tics themselves are involuntary. They can be suppressed temporarily with a lot of focus and effort. So maybe I'm someone who knows that I have a face scrunch type of tic. Sometimes I might feel it coming on and I can really press myself and try not to do that face scrunch. But it's very hard, and it's not something that I typically would think to suppress. But how do we work with treating such tics? Well, with every tic, there's something called a premonitory urge. And it's not something that we typically are aware of, but it is something that exists. And it's some sort of a thing, a feeling, an urge that we get before we feel the need to do that tic. And it's described as a sensation that the patient feels just before they engage in a tic. And engaging in the tic often makes the premonitory urge go away. So, it's very similar to OCD in many respects, where OCD, someone has this obsessive doubt and they engage in a compulsion to make the distress from that doubt go away. But with a tic, you get this premonitory urge, and as a result, to get rid of that urge, you engage in a tic. So, let's take a look at an example here. So imagine feeling like you have a minor itch, and that's your premonitory urge. And then you scratch it because that's the tic. It makes that go away. So scratching the itch makes it go away, but you could force yourself not to scratch that itch. So that premonitory urge is, I feel this itch, I want to automatically scratch it, and in most cases, I probably do automatically scratch it without even thinking about it, and it makes that itch go away. All right, so now we understand tics, and we understand motor, and we understand vocal, we understand simple, and we understand complex. So let's talk about the types of tic disorders that exist. There's actually 3 types. Tic disorders, like I said before, are onset before 18 years of age. Usually they start around 4 to 7 years old, but not always. In order to be diagnosed as a tic disorder, the tic would not be due to another medical condition. There are other medical conditions that might make a person do something that looks like a tic, but not because it's a tic disorder. And it has to be not due to the effects of a substance. So again, using substances might cause a person to react with a tic. Some substances actually long-term can cause tics to occur, but those are different from what we're talking about with tic disorder or Tourette syndrome. So the 3 types of tic disorder are, number 1, provisional. A provisional tic disorder could be a motor and or a vocal tic that the person has for less than 1 year. And in many of those cases, the tics may go away on their own. So provisional, motor and or vocal, but the primary thing is it's less than a year and they may go away. They may not, but they may. The second type of tic disorder is called persistent. And a persistent tic disorder is a motor or a vocal tic. It is not both. And they have been going on for at least 1 year. So we had the first one, which was motor and or vocal for less than a year. And then we have persistent, which is a motor or vocal, but not both, and at least a year. So you can probably guess that the next one, which is the actual Tourette disorder, that's where the name comes from, it would be motor and vocal tics. It must be both. Both do not need to occur at the same time, just over the course of the illness. And again, at least 1 year. So provisional means motor and or verbal, vocal, less than a year. Then we've got one or the other, at least a year. And then in order to be Tourette's, it's both motor and vocal for at least a year, and not caused by some other reason. So here's some common misconceptions about tics. One is that tic or Tourette disorder is something more than motor and or verbal tics. There's nothing else going on. It's just tics. Another misconception is patients always shout out obscenities or make obscene gestures. As I said previously, that's not true. It could happen, and it does happen sometimes, but that is the definite minority as opposed to other things that we talked about, like the face scrunch, the eye roll, the jerking, the sniffing, all those types of things that we've already mentioned. So, do tics go away? Well, like I said previously, some tics will go away before a full year. If they don't go away before the full year, then this is what happens. 1/3 of the patients will stop experiencing tics by adulthood. 1/3 will experience reduced tics by adulthood. And the last third will experience persistent tics throughout their life. All right. Couple pointers for parents of a child with tics, things not to do. First, you should never punish a child who has tics. They're not doing it on purpose. They're not saying, oh, I can really make my parents mad if I start doing this behavior. So punishing them has no effect other than making them feel bad about something that they don't control. Similarly, telling your child to just stop. Well, if they could just stop, they would have just stopped. They're not happy about sitting around and being at school and having these tics occur and potentially have other kids making fun of them or snickering. Again, it's not something that they're controlling per se. They're not making it happen, so telling them to just stop is not going to have any impact. How about forcing them to sit still if they happen to have motor tics? Well, again, it's fine if it's a voluntary reaction, but when it's not a voluntary thing, that's not really going to do anything but make them feel shame, trying to make them sit still. And similarly, if it's a vocal tic, forcing them to keep quiet. Again, these things don't work when it's not something that the child is purposely doing. So what should you do for a child with tics? Well, number one, be compassionate and supportive. Understand what they're going through, the fact that they don't want to be doing this, but they can't help it, and they want support to figure out how to stop doing this thing. Assure them that you will get through this together. knowing that they have their parents that have their back, someone on their side, someone helping them work through this, is very helpful and shows compassion. And finally, seeking treatment is important because there is treatment for tic disorder, and it can be very helpful treatment, and in some cases they can make it go away so the person isn't experiencing or expressing the tics. It's also important to remember that if this is a child who is going to school, you need to work with their school to explain the disorder and seek an accommodation. If you've got a teacher who doesn't understand tic disorder and they just see the student being disruptive, they may call it, or doing things that are taking other students' attention away from the class, the teacher may react in a way, again, to try and shame them or sit them somewhere else in class so they're not seen by the other students. So it's important that the teacher become educated, and this is part of what a parent can do. So what do you do about Tourette syndrome or tic disorder? Well, there's a couple things. There's habit reversal training, which has been around for quite a while. Teaching the child how to recognize the premonitory urge and to change the habit. Well, I talk about habit, but then previously I said this wasn't something that they're, voluntarily in control of. And the point here is they're initially not in control of the tic, but part of the training is to teach them to become aware, to raise their awareness of that premonitory urge, and then put some things in place to help treat that. And this is where we talk about another treatment, comprehensive behavioral intervention for tics, or CBIT. So CBIT is really comprehensive, as the word says, because it helps the child become aware of their tics, aware of their premonitory urges. It helps them develop strategies to counteract the need to do the tic, which can be very simple and very effective. And it works with the parents as well to help be compassionate and supportive of the child. And you can get some very, very positive results with this. Also, it's important to mention that medication is used sometimes with tics, but not necessarily always needed, because CBIT or HRT can be effective. So if we are talking about medications, though, let's talk about different types of medications that may be used. One note about medications, first off, I am not an MD, so I am not giving medical advice here. I'm simply educating you about Tourette syndrome. It would be important to speak with a qualified doctor, and when we talk about this, most of the qualified doctors would be psychiatrists. So I encourage you to speak with a psychiatrist if you are considering medication. So one of the types of medications that is used is antipsychotic medications. Haloperidol, which also goes by the name Haldol, or Pimozide, which goes by the name Orap. Then we've got atypical antipsychotic medications. It could be aripiprazole, which is Abilify, or it could be risperidone, which goes by the name Risperidol. Those are two of the types. Then we've got the next type here, which would be the alpha-2 adrenergic agonists. That's a mouthful there. I'm going to try and say it one more time. Alpha-2 adrenergic agonists. And examples there would be clonidine, which is called Catapres, or guanfacine, which is 10x or Intuniv. Then we've got botulinum toxic injections. Sometimes people call these Botox injections. Botox tends to freeze muscles so that they can't tick or move in many cases. Additional medications come down to psychostimulants, and that would be something like methylphenidate, which is Ritalin, or it could be amphetamine salts like Adderall, And then we also talk about selective serotonin reuptake inhibitors. There's a long list of those, often thought of to be used with depression or anxiety, but also sometimes are used for tic treatments. So this has been a basic beginning education about Tourette syndrome, what it is, what it isn't. It basically means tics. Tics can be motor, tics can be vocal, they can be simple, they can be complex, it can be one or the other, or it can be one and the other. The whole point is it really doesn't matter because the treatment is the same, and there are effective treatments out there for tics, one of the most common being the habit reversal training or the CBIT training, and there's medications available if need be. So if you or someone you know has tic disorder or you think they might have tic disorder, you can speak with a professional about it and learn about the options of how to deal with it. So I want to thank you for taking the time to educate yourself about tic disorder. And if you find this video to be helpful, please help to share it with others by hitting the like and subscribe buttons. By doing that, it helps the videos become more easily found on YouTube, and then more people can get help. I get nothing from these videos except the pleasure of sharing information to make sure that people are properly educated about issues that might be occurring to them. If you or someone you know may have OCD, we have a free OCD support group. You can sign up for that at stopmyocd.com. And we will bring you additional videos on additional issues. Thank you for visiting, and please again, like and subscribe.